Hi everyone, I'm Dr. Wilfred Koon from The Point Dental. If you've ever felt nervous about dental treatment, you've probably heard terms like sleep dentistry, IV sedation, or general anesthesia. And maybe you have wondered, are they actually the same thing? And today I just want to explain what general anesthesia is and how it differs from sedation, and why having it on site in our clinic makes such a huge difference for patients, especially those with severe dental fear or complex treatment needs. First, let's clear up the confusion. What general anesthesia really is. General anesthesia means you are in control, fully asleep state during your dental procedure. You're completely unaware, you feel no pain, you don't hear or you don't see anything, and you won't remember anything. And it's managed by a specialist anesthetist, a medical doctor who continuously monitor your breathing, heart rate, and oxygen level, just like in a hospital theater. And oxygen is supplied continuously to your body, essentially helping you to breathe while you are asleep. And during GA, you're deeply asleep, not merely drowsy or relaxed, and you will not wake up halfway through. Now, this is very different from sedation dentistry, sometimes also called twilight sedation or IV sedation. With sedation, you remain conscious and you breathe on your own. You feel calm and time passes quickly, but you're still lightly aware. And sedation is perfect for shorter or simpler procedures, or for people who just want to take the edge off their anxiety. But for patients who are extremely fearful, have a strong gag reflex, or if they need multiple treatments in one visit, that's where general anesthesia becomes life-changing. At The Point Dental, we have a fully equipped and registered purpose-built general anesthetic suite right here in our clinic. That means we can safely perform procedures under general anesthesia without sending you to a hospital. You are cared for by a specialist anesthetist and a registered anesthetic nurse throughout the procedure, from the very start all the way until you're fully discharged. And your vital signs are constantly monitored. You wake up slowly and comfortably and recover in our recovery lounge with our caring team by your side. So why is having general anesthesia right here on site such a big deal? So let's talk about what usually happens when the patients are sent to a hospital for dental surgery. Even if you're seeing a private dentist and get referred to a hospital, it often depends on availability. And hospitals will always prioritize medical emergencies first. That means dental procedures are usually scheduled last, and they can easily get delayed or even cancelled at the last minute. For dental surgeons, there are sometimes dedicated sessions in hospitals, but those time slots don't cover every kind of dental procedure. And for more complex treatments like what we do here at The Point Dental, especially full arch all-on-4 transformations, hospitals simply don't have the setup or the equipment to support that. That's why having GA right here in our clinic makes such a difference. You get hospital-grade safety, but in a space that feels familiar, calm, and built entirely for dental care. And for patients with dental fear, that control and familiarity makes all the difference. Unlike hospitals, we have all the specialized dental technology on site. Our intraoral scanners, x-rays, the digital planning systems, everything we need to diagnose, plan, and treat with precision. It means we can focus completely on you without worrying whether the right equipment or resources are available. And most importantly, you are cared for by one of our highly trained team, people who actually an expert in dentistry and understand what dental patients need. Medical nurses are incredibly skilled, but their focus is medical care. Our team knows dentistry inside and out, from the procedures to the emotional support that fearful patients often need. So having GA on site means everything happens under one roof, safely, smoothly, and with the same familiar faces guiding you every step of the way. So what kind of treatment can be done under general anesthesia? Almost anything, from fillings, simple extractions and wisdom tooth removal, to complex implant surgeries like all-on-4 or full mouth restoration. We also use GA for patients who have severe dental fear, have strong gag reflexes, have disabilities or special needs, or simply prefer everything to be completed in one visit. And having GA on site let us combine multiple treatments in a single session, saving time, reducing anxiety, and avoiding repeated procedures. And recovery is usually smooth. You wake up slowly in a calm recovery area, looked after by our anesthetists and nurses until you're ready to go home. And most patients say it feels like only a few minutes have passed. And the best part is you go home with your treatment done. No pain during the procedures, no trauma, and there's no hospital waiting list. So by offering GA right here in our clinic, we give patients hospital-level safety with the comfort and personal attention of a dental environment. For many of our patients, especially those who have avoided dentistry for years, this has been truly life-changing. They finally feel safe, they can wake up with a new smile in one visit without fear holding them back. And it's not about luxury, it's about restoring confidence, health, and the peace of mind. So if you have been delaying dental care because you're scared, you don't have to anymore. At The Point Dental, we believe everyone deserves treatment that's free from fear, and our on-site GA facility is one way to make that possible. I'm Dr. Wilfred Koon. Thank you for watching, and if you have any questions about GA or sleep dentistry, please reach out. We're here to help you take that first step calmly, safely, and without fear.